In this video, I'm going to go over the coronary circulation using this giant heart model, and we're just going over the vessels that you need to know for lab. Coronary circulation is highly variable, so we're going to focus on what you need to know for lab. This model is nice because I can remove the right auricle there, and I can remove these vessels. So you can see this is the base of the aorta, and you can see the branches. So this branch here, this would be the right coronary artery, and this would be the left coronary artery. So here from the right coronary artery, we're going to follow, and we come to this branch that goes down the right lateral side of the heart. This is the marginal artery. If we continue on from here, so we're continuing, again, that branch is the right marginal artery. We continue posteriorly. I'm going to try to pick this up with one hand and not tear it apart. But we come to the posterior side, so this is still the right coronary artery, but now this is the posterior interventricular septum, and the vessel, the artery that travels along the posterior interventricular septum is the posterior interventricular artery. Back on the anterior side, and now we're going to go down the left coronary artery. So this is the left coronary artery, and this is where it branches. So if we had this intact, it would be right at where the pulmonary trunk and the left atrium starts. So you would just see a little bit of that left coronary artery. The left coronary artery branches, we're going to go here first. This is, in this artery travels down the anterior interventricular septum, and this is referred to as the anterior interventricular artery. And then this branch here, so again, this is the left coronary artery, and then this branch, and it snakes around posteriorly to the posterior side. So continuing from the left coronary artery around and this would be the left coronary sulcus, around to the posterior side. This is the circumflex artery. So coming along posteriorly, circumflex artery. Now I'm going to do the veins. So the veins, the coronary veins, are even more variable than the arteries. You only have a few that you need to know. So, and they will travel along the same pathways as the arteries. So in that anterior interventricular septum, where we saw the anterior interventricular artery, we have a large vein here. This is the great cardiac vein, and it will snake to the back to the posterior side. I'm going to pause it and flip it over. This is a continuation of the great cardiac vein. Now we're on the posterior side. And here, the posterior interventricular sulcus, this artery is the posterior interventricular artery, and alongside it we have a vein. This is the middle cardiac vein. Now you're going to see where the great cardiac vein and the middle cardiac vein will merge into this large dilated sac. It's like underneath this is the left atrium. This is the inferior vena cava. Right here, this large area, that is the coronary sinus. And those are the only coronary vessels that you need to know for this lab.